Sai, you spoke about the aspect of initially working with the Indian Air Force and then solving the problems and then how you move. But what inspired you to solve this problem in the first phase itself? Like what happened?
So initially, I started working as a project researcher. I started approaching an hospital network around the region where I am located in Mumbai, Pune. So in this city, there are multiple hospitals. So started talking with doctors, understanding the problems what they are facing. And once, example, Doctor A tells me what is the problem he's facing, I will try to validate it with other doctors in the similar field.
Hi, Liffers. Welcome to the Liffy podcast for today. And today we have one of my cohort friends who was with me in the Liff Global 2022 cohort with me. We have Sai here, who is the founder at Pacify Medical Technologies. Sai, welcome to the Liffy podcast.
Thank you so much for having me.
So, Sai, you have been a part of the Liff Global 2023-2022 cohort, and you're again from India. So can you talk a little bit more about your innovation to our listeners so that they get an understanding of your product and solution?
Sure. So we are in medical device space. So we have developed a surgical device for a plastic surgeons for treating a large wounds. So the problem what we are solving for doctors are when they are treating a large wounds patients, there is a skin loss on the human body due to an accident, burns, or any blast. So what a surgeon does is harvest a healthy skin from the other part of the body and stitch it on the wounds. This is sounds simple, but when it is a large wounds, maybe like 50%, 70% wound area, a surgeon faces challenge for transplantation of the skin because there is hardly any skin left in the human body for transplantation. So we harvest a small patch of skin, we mince it and then spray it on the wounds. So by using a small healthy skin, we can cover a larger wounds, practically expanding in 30 times. So that is the overall the innovation is about, and we call the device as skin spray gun.
Wow. I think that sounds incredible in terms of the approach that you are doing, context to what the normal practices. And again, Sai, congratulations on doing a pilot with the Indian Air Force. So what has that experience been? And if you could talk about that, because that's a proud moment for anyone. But again, congratulations.
Yeah, thanks a lot. So my journey started with defense through understanding the problems what they are facing. So the problems of blast and burns are very normal when it comes to defense. So after understanding the problem through different case studies which are published, I understood like how our solution can be fit in that scenario, and then we approach defense, and we got an appointment to present our solution to Indian Air Force through one of the this grants and platforms. So the experience till now is really good. It has helped us to get the product from an initial POC to the market ready stage now, and also the respect or since we are working with the Indian defense or any defense, the respect what we get in others like normal society when you tell our what the work we are doing for the people. So it is also a proud moment as you told about that, and it also helps me during like a hiring process or something like what, since we are an early stage company, so always people ask me when hiring what's in for us. So I always present it like if you are working with us, you will be supporting India in one different way using your skills and experience. So that is also one good thing for us.
And Sai, you spoke about the aspect of initially working with the Indian Air Force and then solving the problems and then how you move. But what inspired you to solve this problem in the first phase itself? Like what happened? When did you get the idea and you thought, okay, I want to go? Like what was that thing that happened?
Fine. So initially, I started working as a project researcher in a lab. So what a project researcher does normally is understand the literature and find a problem statements what are there from the literature review. But in my case, what was different is I started approaching an hospital network around the region where I am located in Mumbai, Pune. Fine. So in this city, there are multiple hospitals. So started talking with doctors, understanding the problems what they are facing. And once, example, Dr. A tells me what is the problem he's facing. I will try to validate it with other doctors in the similar field. So that all innovations or motivations came from the problem itself. So I came across this problem where there was no like innovations happen from last 30 to 50 years in India. Okay, I thought why not work on this, and also the problem is very large, and it is not just a domestic problem or not so like a city or a metro problem. It is also in the rural India problem. So, and the problem is not just in India. What I came to know after like participating in program like LIFT, when I met surgeons from this UK and other places, they also face this problem but at different scale. So when I thought why not then focus on this problem, and then once a problem was finalized, then I started finding out the solutions how to solve that problem. And one thing which helped me to solve it was the skin spray to solve that problem. That's how my journey has been.
Wow. So I think with that perspective and starting from as a researcher and then working more with the users or example the executioners who would use the product or example the solution, getting a perspective, and then again Liv amplified it with you getting your global perspective. But that's it's pretty awesome in terms of what you said. However, have there been any pivots in the product? If you can talk about the pivots you've done in the product and what were the learnings, or were there any interesting pivots, one or two, or your favorite, and then what was the most important learning? And that could be very interesting for us to hear as well.
Sure, Suraj. There is a pivot in the work what we are doing, but not a very it's like very different area in the same field. Just it was more what you more focused thing what we wanted to achieve. We started working on a skin spray as a concept, and then once we had that POC ready with us, we started talking with the doctors. Okay, I attended like different geographies, not only on single doctors. Okay, and what I came to know, there were doctors who tell like size skin spray. The whole concept is very nice and fascinating and really helpful. What about the one step before skin spray? Because when you're harvesting a skin, we get a sheet of skin, and I should cut that skin into very micron pieces, like microscopic pieces, and then load into the device. I used to tell them like cutting in something a sheet into microscope, like very small. It's very easy. Like in Indian content, when in my kitchen also I'll see my wife and mother cutting the onions very small. I thought it's very easy, but the surgeon told me, "Sai, that's not so easy what you think of. Why you don't even try to make that?" Because till the point I thought like skin spray is a challenge. Okay, applying the skin on the wound was a challenge. Then I thought after I came across this multiple times, surgeon used to tell me, "Sai, skin spray is fine, but take me one step further. How we are able to achieve this?" I should do this in lab, and being a motivated person, an innovative person, I thought like this is not a big challenge. I will do it. But when I visited hospital and seen that whole how much time it takes for a surgeon to cut the skin, it was like just imagine a patient is on the anesthesia on this time whenever a surgeon is cutting the skin, and the time is very crucial for the surgeons, and I should reduce that. So what happened today? We have the device, a skin spray. We also have a device called a derma dice or a skin mincing device, just one step closer. Okay, and we never thought like we need a device of skin mincing, but after talking to users, what you understood, there is a gap of skin mincing. That is the first gap I should solve. And to keep it very simple, what these both devices are, the skin spray is simple to a mobile phone. Okay, and but the skin mincing device is more of a charger. Just imagine I have made a phone without a charger. A user cannot use it. Okay, it is as simple as that. So first thing was I should make a charger. It should work. Then I will give a mobile phone. Then it will work, and that is how it is. So today we have a device for this, which is already in the market, and also we have this skin spray. And so that is how we pivoted from skin spray to skin mincing device.
Oh wow, it's a totally add-on thing that I'm also surprised in terms of that again a demand and a need came, and you're able to get that aligned as well. And listening from you, I get a feel that most of your customers are example surgeons and example doctors. However, who are your customers, and have you used any interesting marketing strategies around it, or you face any marketing challenges? So if you could talk about the marketing, the way you do it, or example interesting aspects, especially in a space where it's medtech with a hardware, so what has been your marketing strategies?
Fine. So we work with surgeons. Okay, that also most of the time are senior surgeons in an hospital, like equivalent to an HOD or head of department in plastic surgeries, example. So these surgeons are not much like a digital friendly or something. So and they always ask for a proof. Nothing. If they see something on a TV channel or something, they will not going to procure that and use it. So the channel here, what we are using, it's more of an influence. Okay. So there are called key opinion leaders in this, who are the senior most leaders, surgeons in an community. Maybe in somewhere in Western India, there will be a surgeon, few surgeons. I will approach them. I'll explain them this, and with the help of the surgeons, they will make a case studies around a patient using that, and we will publish this in coming in conferences, plastic surgeons, burns conferences, and this. So what happens? There will be many surgeons coming to conference, and when you are presenting the cases, so that will create an interest or awareness about the device. And once that is created, then the next step for us will be visiting these hospitals, okay, and then showcasing them and giving them a demo about this. That is how we are approaching with this. So it takes its own time, because it is not a like a idea or something which surgeons are using on day-to-day basis. It is a new thing for them too. So for understanding, for implementation and things, it takes time. uh, but the starting point for us is always the surgeon, and we use the surgeon network to reach out to other surgeons.
Oh, wow, I think that's a very interesting long-term organic way of feeling, marketing and creating publications and documentation around it, and then in using it to leverage and influence the next layer of it. So I think that's very clever way of doing it. So I think kudos to you again. I'm just trying to also understand, or I have this question that, like, you've been able to do the research, and then work with the users, being able to influence, align marketing, and then commercialize your solution, right? So, and we have in Lift, we have a lot of lifters who are, like, in the very good in the R&D or the research stage. So what are your tips or advice for these lifters to move their product from R&D to commercialization?
Fine. So one of my mentor told me about this. The time I am not with my user is the waste of time. I should be always with the users. Okay. Once a week, I should talk to with my users minimum starting. And what we done as we move forward, for when I was a researcher, a part of Saiprasad was like 3 days I will be doing my research. The next 3 days or 2 days I will be in the with the doctors. Okay. So whatever feedback I should get from that, I should implement in my research, make it up, and again show it to the users. So that was a process going hand in hand. So that is only the feedback or the suggestion I like to give someone who is at a research stage and planning to get it in the market, because there is no hard and short rule what will work with the users. So it is always start with the user from a very initial press whenever it is possible. Don't wait for something a milestone will be achieved, then go and talk to the users. So I will not suggest that.
Okay, perfect. Perfect, Sai. So we spoke about, like, your inspiration, then the product, and like, how you've been able to market the product, and like, what are your advice in terms of commercialization. Now one of the things that I would want to now pick your brains is, like, you're also one of the winners at the Lift Global 2022 cohort. So this year, example, there's going to be new Lift Global 2024, like, who would be applying. So, what is your one piece of advice for these lifters to present better, or to talk better, or in terms of something that you've learned which helped you win? Example. So, what is your learning or your tactics or your thought when you go for these kind of presentations? So if you could talk about that, your winning sauce or secret behind the Lift 2022.
Fine. For every researcher or every person working on his product thinks like his product is the best in the world for something, and we are going to change the world or kind of this. It is a really good thing, confidence to have. But if you can support this with a data, real life data, that will be nothing like that. And so my secret sauce is always that what I'm telling, it is my work should speak louder than my words. So that is my secret sauce I can like to share with the leafers.
Okay. So, Sai, moving on from, like, the aspect of the inputs of how you are able to present using leveraging data. Now, LIF is again now a community of around 15,000 LIFers spread across 17 countries, and there is so much of diverse culture, and different maturity of the startups and the segments, but all super amazing, brilliant innovators. So what are your expectations in context of collaborations with other lifters? Are you looking at some kind of research collaborations, or some kind of co-selling, or some kind of co-partnering, or licensing your solutions? So have you thought about it? And if you have any certain countries in mind?
Sure. One thing is, being a researcher myself and a product developer, always happy to share my knowledge of product development, especially hardware product development, and currently in the MedTech thing. So anything related to electromechanical devices, happy to help. And after this, my area of interest currently where I'm working in, like wound care and related tissues or cells. So that is my interest, and anything in around this will be, I will be happy to contribute and work with someone from a collaboration perspective. And from a country's perspective, if you ask me, so nothing has specific areas in my mind, but wherever the social impact problem of burns are very huge in numbers, mostly are developing countries. Even in developed countries too, I'll be happy to collaborate or co-license this technology, because my only motto, I think, like, is going fast to the market. If I take it or someone take it, but going fast to the market and earlier to the market is the overall goal. Yeah.
Perfect, amazing. And in context of the developing countries you spoke about, so these differs. Example, if they are in these developing countries, are you seeking like they should be from certain segment, certain space, or certain connections? So what is your, or just being in the developing countries is good enough, or what are your thoughts a little bit around it?
So having a connection with the hospital is something which will be of my interest, because the whole device areas what I'm working is directly connected with the hospital. So a person from a developing country and connection with the hospital is good to go, because when we have connection with the hospital, we can figure it out which department, what are the areas, how are the patients, and multiple factors coming in. Yeah.
Amazing, incredible. And again, Sai, so this is my third. Congratulations to you. I think I've the highest amount of congratulations I've done on a podcast. But again, congratulations for being a winner at the IMA Health Tech Summit, where you got the award for the later stage startup as a winner. So, and again, I am Ahmedabad is very close with me as well, because my professor again from there, and it's a very prestigious institution. It's very focused in terms of doing it. So, congratulations on that. So, how did you feel about it? And so what was the event about, and if you can talk to us about it?
Fine. So it was a proud moment. First of all, as you mentioned, I am Ahmedabad, one of the prominent institutes in management in India. And other thing is, after winning this awards or this, I was able to get a good connections in the healthcare fraternity, senior peoples in different industries. I'm able to connect, and if I pitch to them, there are multiple forums I keep visiting, and they will tell me, hey, I seen you winning an award. Was that you itself? I was also at this event and this. So it has helped to build a good network with the credible peoples in the industry. And always it is a proud moment for me to present my ideas and innovation at the larger forums.
Wow, incredible. Now, just to move a little bit off, the serious discussions of collaborations and the part. So, one of the questions that we ask in the podcast to all the guests is that if you would have one superpower, what would that superpower be, and why?
Fine. One of the superpower, if I had it, could be the best understanding the person whom I'm talking with beforehand, or something of power. That will be the best thing, because I believe as a human we are a social people. We always, the day starts with other people talking or interacting. And if I'm talking with doctors, if I can understand doctor better, I can make my device more better. Instead of they speaking me, I can just get a power, just go inside the head and understand well in before. So that if I had that superpower, I can make better devices or better solutions using my innovations.
Wow, I think that's for the first time that we have understanding the mind, or getting inside the mind as a superpower. Now coming to the last part of the podcast is that so in LIF again the breadth of the alumni is wider, and after the LIF global cohort or the advanced cohort happens, we all get back to our lives. In the residential, the bond is pretty incredible, and then the flame slowly disconnection happens. However, the network has got very diverse innovators, very good quality from so many countries. And the academy is doing a lot of activities as well with other partners, and there are multiple things happening. But however, what are your thoughts on what kind of an activity, like, the alumni could do where we can engage more lifters?
Okay, if this academy like as they are doing like their like storytelling sessions or workshop kind of thing, so anything which are very deep in a particular area, that will always good, because having something for 1 hour or something, even YouTube can help. About going something beyond this, like for I was a part of storytelling workshop. It was really helpful. It was like multiple session and going deeper and deeper different modules and having that practice. So it was more of a real time work, and that has helped me to improve as a person what I am, because it is always for me talking about the cases with the doctors. So this kinds of program, like doing it on a deeper scale or on the longer modules, that what I think, and different areas where uh, innovators like us have challenges, that will be the best help for us, I think.
Wow. So I think as you rightly said, in context of, like, deeper modules would be like very interesting for you to go more deeper into it. I think get it. I think it makes a lot of sense, and that is something that is not available because it becomes very specific as well. I think pretty amazing. Sai, I think thank you for being on the podcast, and it's been incredible to, like, know your journey, how you started as a researcher, and then you slowly moved on to working alongside with your customers. And I love the tag that you said that anytime you're not with the customer is time, you're like wasting your time. That's pretty awesome way to look at it. And again, congratulations on all the awards that you've gathered and you've got. And I think I wish you all the success for times to come. And thank you for being on the podcast, and look forward for talking to you soon as well.
First of all, thank you for the opportunity. It was amazing talking about my journey, also reflecting on my learnings, and a good opportunity for me also to just see at things what I can do it better myself. Because when you share something, it is also a reflection for me too. So thank you for this opportunity.